I decided I'd take a walk because it was such a nice day. And as I was walking, I kept feeling like an ache in my left arm. I came home and seemed fine. And all of a sudden, I started feeling this pain again in my arm. They called the medics. One of the medics came over to me. They told me they were going to take me over to Ocean Medical. The next thing I remember was hearing a voice. Barbara, I'm Dr. Appolito. You are having a heart attack.
Unfortunately, all too many women have those exact stories. Not too many survive, as we know. Dr. Dawn Calderon, Chief of Cardiology, is here from Jersey Shore University Medical Center, part of Meridian's Cardiovascular Network. How are you doing?
Fine, thank you.
Those stories are powerful.
And all too common.
Yes. What do you see in your daily work?
What we're seeing is some progress, but what we're seeing still is women afraid to come in or ignoring symptoms, and then maybe not being recognized by the medical community that there really are problems and that she may be experiencing a heart attack.
Is it hard to even get a woman to come in with symptoms? I mean, do you find that women ignore the signs, keep going, they're just pushing themselves through their day and they may not be listening to their bodies?
Unfortunately, we put ourselves last. We have so many other priorities. And
the house, the kids, the husband, the dog, work, whatever else.
Everything. And I hear it all the time. And my advice to women always is you have to make yourself a priority, because if we're running the families and running the household and everything else, if we're not there, things are going to fall apart anyway. So put yourself first. Make sure you put yourself into the schedule and put yourself at the top of the list when something like this comes up.
You know, it seems that there are certain illnesses that women are especially in tune to nowadays. I think breast cancer is one of them, maybe even skin cancer. Is cardiovascular disease at the top of the list? Is it even at the middle?
It's getting there, and kudos to the breast cancer societies and media for covering that. Women are terrified of breast cancer. There's been absolute wonderful marketing and education. We need to let women know, though, that heart disease still kills way more women than breast cancer will.
Is it true that it is the #1 killer of women still?
Still the #1 killer, and still #1 when you add the next 3 combined.
What should we be looking for? What are the symptoms? What are the telltale signs?
So a lot of it is exactly like what you see on television. So the most common symptom still is chest pain. And then in women, we start getting some of these more vague things. We get fatigue, we get tiredness, we get dizziness, shortness of breath when you're exerting yourself, nausea for no particular reason, a hot flash when you're not really having a hot flash. And what women really need to do is just be aware that something's wrong. I think we usually do know something's wrong. We just have to listen and figure out what it is.
And some of those symptoms could be confused with a lot of other things, fatigue, stress. But at what point do we say, okay, we're not exaggerating, we're not being hypochondriacs if we call the doctor and ask, is this normal? Is it pretty early on?
We need to.
Yes.
And I think we really know when something's wrong. We want to wish it away, but I think we need to say, got to check and see. No doctor will ever fault you for finding out what's wrong. I always tell my patients that it's important that they call me, and after that it's my responsibility to figure out what's going on.
If you have called the doctor, you are diagnosed, you know you have some kind of heart disease, what should you be doing? What are the lifestyle changes you need to make?
It really depends on what type of heart disease we're talking about.
Let's give some for instance.
So the most common thing we talk about is coronary artery disease, which is a plumbing problem. There's blockages in the pipes. So a lot of that can be managed by diet and medication and exercise, lifestyle modifications. The most important thing any of us could do to help prevent or calm things down is to stop smoking. The very most important thing that we can do.
If you're smoking, stop.
Please stop.
Yes.
Keeps us in business. That's what I tell my patients. It will keep us in business as long as there are cigarettes around. There are going to be people that need cardiologists.
Congenital heart disease is much different, and that is your specialty. Define that for us.
So congenital literally means from birth. So it's all of these, what used to be called blue babies, or people with holes in their heart, or missing parts, or malformed parts. So that's more of an architectural problem.
Meaning the heart's not functioning the way it should, and that came from birth.
It came from birth because there's an abnormality in the structure. The wrong door was ordered for the door frame, or the living room was put where the dining room should be, is the way I generally describe it.
What do women do if they have congenital heart disease?
Oftentimes they will know very early on. Many of my patients come in to see me, all adults, with their parents, because mom's been taking care of them since birth. And it really depends on what their congenital heart problem is, but it's again something that needs lifelong surveillance. We only repair, we never actually fix and cure.
Okay, it's not possible to fix and cure.
We have to really continue to watch and see, because if something was made wrong initially, our best bet is to just keep an eye on things.
As women with congenital heart disease enter the pregnancy phase, there are some risks that are associated with that, and tell us what those are.
It's a really exciting field, though, because so many times women were told, sorry, don't have children. Probably the most exciting thing I get to do is re-counsel someone and say, I know you may have been told this, but we're getting smarter and we know how to handle this. So it's important to assemble a really good team of people to know the risks ahead of time, to try and anticipate the problems, and planning for everything.
Let's talk about 365 Days of Heart. This is Meridian's campaign to promote heart-healthy living. Tell us about it.
So it's something that we kick off, and basically we want people to know that it's a year-round activity. It's a year-round initiative, lots of speakers, lots of different events and publicity and that type of thing going on, just to keep it on the front of people's mind.
Providing information, disseminating information. How can people get involved? Where can people join up?
If you check out the Meridian website, there's lots of information on that. There will be lots of information in the local newspapers, events around town, different talks. A lot of our docs will be going out into the community to give talk and information. Lots of health fairs we go to. So all different ways of getting involved, but the first thing is to make the commitment.
And the first thing for women in terms of prevention is information.
Right.
And knowing what they need to be looking for, knowing what the signs are, knowing how to live a healthy lifestyle to prevent heart disease.
Right. I really feel that as women, our biggest risk factor is lack of education, lack of knowledge in this field. And it's so important. Our kids are going to learn what they live, so it's important for us to really set a good example and to make ourselves a priority.
You're setting a good example. Dr. Dawn Calderon, thank you so much.
Thank you.